Hi everybody, Dr. Anjana Bana here, and thank you for joining me once again. We've had a bit of a creation hiatus, so we're back with male aesthetics. So we've got Cillian here with us. So if you guys know Salt By on Instagram, that's Cillian, and we're super excited that he's here with us. And today we're going to do his first filler treatment. Cillian has been coming through for some other things over the last 6 months, and also doing some nice maintenance and professional home care at home. So we're just going to chat a bit about what you've been doing, Cillian. So I'm just going to have a seat. So Cillian, the first treatment you ever had with us was a superficial chemical peel. So that was like your first foray really into medical aesthetics, am I right?
Yes.
So why did you come see us initially? Like what was your main concern?
I had a lot of uneven skin tone. I had issues with my confidence because of breakouts that I would have. You've
Yes.
been seeing I had a lot of breakouts towards the upper part of my head.
Yes.
And then also from the mask to over here.
Yes.
I had a lot of oily skin too. So
Yeah.
that was generally my main thing. Also, I wasn't really happy with the structure. I've always wanted cheekbones.
Yes. So that was one of the first things Cillian mentioned to us, was the cheekbones. And it's actually, maybe now, but previously it wasn't something that guys would ask for. So what we've been noticing in our practice, sort of men come through for botulinum toxin. I was going to say the proper word, I can't say the proper word, Botox or similar anti-wrinkle injection, neuromodulator. So that's a big part of male aesthetics. And actually we did do some for Cillian. So if you can wiggle your brows, but you can if you raise your brows, Cillian, and if you look cross, if you try and look cross. So there is movement there, and it's important when we're doing anyone's face, not just the male face, that it looks natural. And then there's a certain way of doing male anti-wrinkle injection. So, and one of the big things is not getting the eyebrow to shoot up, as they call it, the Spock brow. And Cillian, you've got the typical male brow, like a sort of a flat brow. So starting from the top, in terms of the male features, usually the brow is really flat, but it's not always the case, So we're gonna delve a bit further in the video about like typical males, typical females, but we can't use a cookie cutter approach for our patients. If you look at Henry Cavill, he's got that typical male brow, and his bromance buddy, it's what's his name, Jason Momoa, Aquaman. He's got this very sharp brow, and they're both very masculine and very attractive guys. So there's no there is a wrong with a male eyebrow, but it's not that rigid. It must look like a Neanderthal sort of look. But Cillian, you also do your brows. You also shape your brows. So I've noticed when I was looking at a couple of male brows like those guys, it's also it's like a thing that guys are shaping their brows, they're grooming themselves. So for Cillian, why we did the toxin was, besides the activity of the muscle, and because you work in the medical field, you mostly have your mask on and you see patients, so you have to have like a positive attribute. So he was looking worried, he was looking tired, so to alleviate that, and also you're getting a lot of breakouts in the forehead, and botulinum toxin also helps with that sort of thing. So it had like a double whammy effect. And we've been doing your peels around the eye, microinfusion, and today we're going to do fillers. So Cillian was asking me before, how is he going to feel, and I was like, pain, but it's actually not. It's not painful. It might be a little bit uncomfortable, depends on the patient. We've put some numbing cream on for you, and the fillers actually have numbing cream as well. Most males present to our practice, yes, firstly for botulinum toxin, and lots of them have skincare concerns, acne, scarring, so texture issues. And then they come in, and people don't come in and say, you know what, I've got a line here, I've got this there. It's changed over the years. So you come in and you say, I'm looking tired, I'm feeling, when I look at my face, things are like sagging. Yeah. So that's the main complaint for guys, is looking tired and loss of volume around the eye area. So when we do that area, we have to undertreat. It's very important. So we'll probably do 2 sessions. So this will be your first session for under the eyes, and then the male cheek that you've been waiting for. So when we look at Cillian's face, there's a lot of anterior volume, and in the male face, the anterior area is almost a little bit deficient or flat. So we have to, in a way, reduce that or not add to that. And when you look at a woman, there's everything. With a guy, they say angles, and with a woman, it's curves. So a lot of women have something called an OG curve. So if you look at a 3/4 view, and it's like this very well-defined round curve. With men, it should be flat. They don't actually have an OG curve. So when we look at, they talk about light reflection. Yeah. So for guys, there's no light. Well, there can't be like no light reflection, but it's not a thing. Highlights and light reflection. With women, there is that. So with women, their maximum apex or maximum point of restoration is more lateral on the cheek. So it's like, for men, it's a bit lower and more anterior, and then we try and keep away from that. So you'll notice, Cillian, there has been a bit of flattening on the side. And then what Cillian's doing, and what I see a lot of guys do, as well as a lot of aesthetic doctors and trainers that are men, is that they create a jawline by what's it called, manscaping? What is this what is this beard shaping, or is that the proper word? So like sculpting the area, because you're creating a jawline. So we're going to do that for Cillian at a later stage as well. I'm going to use a different product for that. But today we're going to concentrate on the mid face. And you always, well, not always, but a lot of the time what I do is I restore the mid face first so it can support the under eye areas. And another thing is the male lip. So also, there's this traditional view that the male lip must be thin and flat and square, and there must be a bit of squareness to the male lip that's not very obvious sometimes in the female lip. But if you look at Cillian's lip, and if you go back to our diversity in aesthetics video, if you just like click on that link, and then we discuss a little bit about that, because Cillian is also Indian, so his lips generally are 1-to-1 and a little bit fuller. And there's a move now towards, as I mentioned before, no cookie cutter aesthetics. There's a move to androgyny as well. So like that pretty boy look, I mean, but masculine as well. Like if you think about Thomas Shelby in Peaky Blinders, so I mean, he's got very defined angles, but he's got really amazing round eyes and amazing full lips. So that's almost like an androgynous look. Or if you think about the original androgynous person would be Angelina Jolie. I know that's a really weird thing to say, but she's a muse in aesthetic medicine. So because she is very beautiful, very structural, and as she has aged, whether it's natural or whether it's enhanced, she has a very masculine jawline and very large feminine lips, very prominent cheekbones. So she's technically a very masculine looking woman. And I also see some masculine looking women that are exceptionally beautiful. So I think the rules are guidelines, but they're not the end all and be all. And you were just chatting about there's also something, it's a lip gloss, but it's a medicated lip gloss called Luscious Lips, and for guys there's actually a clear one. So if you're not ready for lip filler, it's one of the things you can do to naturally plump your hyaluronic acid. That's how we got onto the male lip, just chatting about that on the side. But we're going to start his treatment now. Okay, this is the ala groove. So for a man, this is called a tragus, this little bit in the ear. So for a guy, we start at the lower tragus. As I said, for a male, the apex or the maximum projection is a little bit anterior and lower than a woman. So we are here at this alar groove. We're going to the mid-pupillary line, and then there's another line going to this here. This thing is called the tragus, so to the lower tragus. For women, it's usually at a point called Swift's point, like as in Arthur Swift, and the maximum point of projection is usually a little bit higher there, and then the male is somewhere there. So I'm going to go in. We can do a needle, but I'm going to go in with a cannula because I'm also going to I actually do want to give Cillian more of a structured look, because he wants that structured look, and I think it'll look nice, but without feminizing your face. Also to follow the line of your beardscaping as well as your future jawline, creating that sharp sort of angular look. After that, we're going to do some under eye filler. There we go. You okay there, Cillian?
Yes, I'm fine.
Okay.
I can feel my cheekbones coming.
Yeah, so yes, you can probably just feel a bit of pressure, and also hear a little bit of the filler. Sometimes it makes like a squishy noise, like something like that.
Like the Momoa balls.
Yes, yeah. Let's have a look. So a bit of projection, and then also a little bit of improvement already in the under eye area. So
Are we done? The whole one side?
yeah.
I didn't even. Wow. No, for real. Like, I didn't even feel. I felt the first prick, but the
Yeah.
side I didn't feel anything.
Oh, awesome.
Shame I was stressed out, man. And all I'm feeling right now is just like a little bit of pressure, but it's like nothing
Yes.
very, noticeable.
Yes, yes.
Yeah.
Yeah, so
wow.
it'll feel like, because it's a very robust filler. That's what I chose, to give a sculpted, like a more sculpted look. So you will feel a bit of pressure, and maybe at the site, a little bit of stinging. I did have to poke you twice because it wasn't going easily the first time. So that sometimes happens with a cannula, but and maybe a little sensitive there tomorrow, but other than that, not much. And then that's why I like doing the filler here. It's like on the bone or in the deep fat, and then it supports the under eye, so we use less filler under the eye. It's important to use, to go slowly with the under eye, and some people can't have their under eyes filled or aren't good candidates for it. They already have a lot of, they call it edema, like water around the eyes. So it's not such a good idea to do those patients. And sometimes, patients have bags, and that may be like surgically, it might be a better approach for those patients. And then I do like a little snap test. So like if you can look at Cillian's, there's like a lot of elasticity there. He's been having microgold infusion with us, peels, he's been using an eye cream. So, strengthening the area, because it's a really thin area. So because there's good elasticity, it can support the filler. But if there's like a slow move back of the skin, then it might not be such a good idea to jump straight into filler there. I'm going to do the other side, and then we're going to do under eyes.
I can feel it right now. I'm like, oh, I have a cheekbone. You can see it, it's so nice. You can see the difference, can you see?
Yeah. So if we look at you, Cillian, like from before I start this side, so we've just done a cheek enhancement, and it has lifted, it's called a lid cheek junction. So here's the cheek, there's the lid, the teardrop, so it's lifted that junction. So it's created a bit of support and already improved the tired look. That's what a lot of men complain about, is looking tired under the eyes and hollowness under the eyes. And then it'll also, once we do the under eye filler, the light reflection will also change under the eye, because the muscle that goes around the eye is very like dark and very thin. So the light reflections also, it makes the under eye look darker, amongst other reasons why you've got dark circles. And when you put a bit of filler underneath the muscle, it creates more like a lighter light reflection. You okay there, Cillian? Lots of pressure. So we go on the other side now. But like I said, underfilling. So we didn't fill to capacity because the filler will absorb water, and so not to create long-term puffiness. And this is a very light filler, a very smooth filler, different from the filler in the cheek. So I don't want you to put any pressure on your lymphatics. And then I'm going to show you the mirror. So you can see there is an improvement, but over 2 weeks it'll get even better. So where we have like a smooth lid cheek junction, we don't want a bulge. Yeah. And then in about maybe 3 to 6 months, 3 to 6 months, I'm still obsessed with the cheeks. In 3 to 6 months, I might put a little bit more filler in, and then we'll see. And then you get some long-term sustainable results from that. Yeah. Okay, there we go. So your first filler treatment. So that's the thing with fillers. Also, it's to, I wouldn't say under treat, just treat correctly, and not to do too much at once. You can always add at a later stage and perfect what you are trying to achieve, and by doing that you also get nice, sustainable, beautiful results. Okay, let's see. I'm going to show you the mirror, Cillian, then you can tell me thoughts. There we go.
You can see a difference already, eh?
Yeah.
On the under eye, they don't look like, a granny from a Zadro cooking for like 500 people for 5 days straight. They're not sleeping. Oh, I have my cheekbones. I can't get over my cheekbones. Thank you.
My pleasure.
It's so good.
No, my pleasure.
I'm shoot ready now.
So yeah, and it'll look even better after 2 weeks. So tomorrow might be a little bit puffy, swollen, a bit sensitive, but over the 2 weeks, yeah, absorbing all that water, it'll look good.
I'm excited. It didn't even hurt, that I must admit.
Yes, Cillian, you
I was
very
out.
worried.
I thought it was gonna be like, stingy and like very, rough.
Yes.
Really, I didn't feel you put the needle in.
Oh, good.
So that's good.
Good.
Yeah. All the people who are sensitive. Just ease for sensitive viewers.
So both Cillian and I have made it to the end of his treatment successfully, and he's smiling, so I'm smiling. I'm very happy, and I'm glad you're happy, Cillian.
I'm so obsessed. It's gonna be like, oh, I have cheekbones.
So no massaging, and no touching the area, but just like some post-op care in the happiness there. Sorry, I have to do that. So afterwards, after this treatment, it's important to give yourself a rest, easy, no exercise, and you shouldn't have to massage your own fillers. And then in terms of molding, because I see Cillian is like itching to touch it, so it's important not to touch your face or massage the filler. I've molded it and I have sculpted it as it should be. But if you are a bit concerned, or if you've had filler done or you feel like there's a little bumpy, contact your provider and they can provide some guidance on what to do, and you can probably go in and show them. So, but thanks so much, Cillian, and thank you for coming through and joining us for one video of the series of male aesthetics. And if you guys would like to learn more, please comment down below. We'd love to have your questions.
Finally, I have my cheekbones, guys. I'm so excited. You don't even know. But it's all thanks to Dr. Bana. And most important thing, guys, I didn't feel a thing. So for me, that's the biggest win. Aside from having the best cheekbones. But yeah, guys, that's all from me, South by. Hope to see you guys soon. And don't forget to like, subscribe, and follow Dr. Bana.
Bye.
There you go.
Oh, no waving.
This is nice cream, yeah?
I still have to inject you, Cillian.
Oh, my face is asymmetrical. I can feel it.
No, it's just...